Have you ever found yourself or someone you know making excuses when things go wrong, always pointing to outside circumstances rather than looking inward? It is a common human tendency to seek reasons for our struggles beyond ourselves. But when it comes to patterns of substance use, this habit can take on a much deeper, more challenging meaning. Yes, blaming external factors can absolutely be a significant form of addiction denial. This type of denial acts as a powerful barrier, preventing individuals from truly seeing their substance use for what it is and, most importantly, from taking the necessary steps toward recovery and healing. This phenomenon often serves as a protective psychological defense mechanism. By shifting responsibility to stress, job pressure, relationship issues, or even other people, an individual avoids confronting the uncomfortable truth of their own choices and the role they play in their substance use. It is a way to protect the ego from the painful reality that they might have lost control. This externalization of blame maintains a narrative where the substance use is a logical, even justifiable, response to an unmanageable situation, rather than an internal struggle that requires personal accountability and change. Recognizing this pattern in yourself or a loved one requires careful observation. Look for consistent explanations that always point outward, often without any personal reflection on their own actions surrounding substance use. For example, if someone always says they drink because their job is too demanding, or they use substances because their partner stresses them out, this could be a sign. Pay attention to a strong resistance when suggestions are made about their personal involvement or the need for professional help. The key is to notice whether the focus consistently remains on what others are doing or what circumstances are causing their use, rather than on their own choices and capacity for change. This behavior is sometimes referred to as externalization of blame in psychological terms. It is important to understand that this is often not a malicious attempt to deceive, but rather a deeply ingrained coping mechanism. It can stem from a genuine inability to face overwhelming emotions or a fear of judgment. However, it is a significant barrier because it prevents the individual from engaging with treatment, which relies heavily on personal insight and a willingness to take responsibility for one's recovery journey. By identifying and understanding how blaming external factors functions as denial, you can begin to shift the narrative. This awareness empowers individuals to move past the blame game and focus on what they can control: their own actions, choices, and commitment to change. Recognizing this denial is the first crucial step toward taking back personal power and finding genuine, lasting solutions for a healthier, more fulfilling life.